The new guidelines focus on the protective gear healthcare workers wear when taking care of Ebola patients. In this picture, the neck of one of the nurses caring for Thomas Eric Duncan, an Ebola patient from Liberia, is clearly exposed. No one knows how the two nurses at Texas Presbyterian Hospital contracted the virus, but at the Centers for Disease Control and Prevention, Dr. Thomas Frieden explained why the changes were made during a teleconference.
The bottom line is that the guidelines didn't work for that hospital. Dallas shows that taking care of Ebola is hard.
The new guidelines call for no skin exposure, along with rigorous training on how to put on and take off the gear. This has to be done under the supervision of a trained monitor who watches each worker to make sure it's done correctly. In Georgia, a special emergency response team has already had its first training session. The new CDC guidelines also call for double sets of gloves, waterproof boot covers, disposable hoods with full face shields, special masks, and respirators. Ebola is not airborne, but a patient's body fluids can be expelled during some medical procedures. These guidelines bring CDC recommendations closer to those of Doctors Without Borders, the aid group treating Ebola patients in Africa. Doctors Without Borders has rigorous practices that have largely prevented its staff from contracting the deadly Ebola virus. Carol Pearson, VOA News.